I was really close. So I'm always kind of talking about my head and my tail.
I would like to introduce you to a woman named Cynthia P. Bolin. Cynthia was a woman in the prime of her life. Some people say she had it all. She had 5 beautiful children. She had a gorgeous husband, a successful business, and even a big house in the hills of Kentucky. Then everything changed. Cynthia was diagnosed with breast cancer at the age of 35. After a 5-year battle with the breast cancer, many medicines, multiple surgeries, Cynthia died at age 39. She was just a few short weeks of her 40th birthday. My name is Tracy Johnson. Today I want to talk to you about breast cancer. I too am a wife, a mother, a sister, and a daughter. I am also a nurse. For those reasons, as well as just being a woman, I am passionate about the fight against breast cancer and the preservation of life. I invited each woman here today so that I might share my message as well as raise your awareness. According to the American Cancer Society and Susan G. Komen for the Cure, both credible and reputable sources, breast cancer is a disease in which malignant cells form in the tissues of the breast and is the second leading cause of death in women today, exceeded only by lung cancer. Today, I want to inform you of some of the risk, preventative measures, as well as treatment options for breast cancer. Let's begin first with who's at risk. I quote the American Cancer Society as stating, "The main risk for breast cancer is simply being a woman." Why? Because women are exposed to the growth-promoting effects of the female hormones estrogen and progesterone. Having a personal history. You're at greater risk for recurrence if you've already had breast cancer. Having a family history. If you have a first-degree relative, such as a mother, a daughter, or sister, that increases your risk. Age. Of course, the older you are, the greater the risk. But just for your information, as per the Cleveland Clinic, 5% of all breast cancers occur in women under the age of 40. 1 in 8 invasive breast cancers occur in women under age 45. Race and ethnic groups. In the U.S., overall white women have a slightly higher risk of developing breast cancer. However, in women under the age of 45, breast cancer is more common in African American women. Early menstrual cycles. Young women who started their menstrual cycles before the age of 12 have longer exposure times to hormones. Dense or thick breast tissue, especially in women under age 40, makes cancer harder to diagnose. Oral contraceptive use. These are birth control pills. Another exposure to hormones. Alcohol intake. Women who drink 2 to 4 drinks every day increase their risk for breast cancer. Obesity and lack of exercise. Postmenopausal women are at a greater risk because of how the body produces estrogen. Menopause. Going through menopause at a later age increases your risk. For example, a 55-year-old woman going through menopause has a 30% higher risk than does a woman who goes through menopause at age 45. Prevention. Let's talk about prevention. According to the American Cancer Society, early detection is the best prevention. It is the key to diagnosing, treating, and surviving breast cancer. Early detection can be accomplished with screening exams, such as mammograms, self-breast exams, and clinical exams. Mammograms should be done yearly starting at the age of 40, unless you're in a higher risk group, such as having a mother or sister with breast cancer. Then it would be done sooner. Self-breast exams. Women should perform monthly, starting at the age of 20. Clinical breast exams. Your health care provider should do this every 3 years in women ages 20 to 30, and yearly in women 40 and over. The goal of all of these screening exams is to find a cure before they start to cause the symptoms. Making a healthy lifestyle choice, exercise, eat a healthy, balanced diet, limit your alcohol and hormone use. Let's take a closer look at the signs and symptoms of breast cancer. The most common symptoms of breast cancer are a change or the look and feel of the breast, or a change in the look and the feel of the nipple, maybe a nipple discharge. Warning signs you should be aware of include lumps or hard knots, swelling, warmth or redness, change in the size or shape of your breast. Dimpling or puckering of the skin, itchy, scaly, sore, a new pain in one spot that will not go away, a nipple discharge that starts suddenly. Don't dismiss any sign or symptom. Lastly, let's look at some treatments for breast cancer. There, of course, is surgery, a lumpectomy, which is removing only the lump and surrounding tissue, or a mastectomy, removing the entire breast, which may or may not include lymph node involvement. There are medicines. Cancer-killing drugs, such as chemo, can be given orally or by IV. The type usually depends on the specific cancer someone has. There's radiation. Radiation may be used in addition to chemo or surgery. Radiation treatment is done by using high-energy rays or particles that destroy the cancer cells. There's also complementary or alternative therapies. Complementary therapies are used in conjunction with medical care, such as massages or vitamins or special diets. Alternative therapies. These are used instead of a doctor's treatment, such as prayer or psychotherapy. There also may be clinical trials. Trials offered by places such as MD Anderson and our own Pennington Cancer Center. These usually include some types of new chemo and radiation treatments or the combination. Before I conclude today, does anyone have any questions?
I have a question. Does Louisiana still have the highest rate of breast cancer deaths?
Not anymore. We were the highest. Now it's Connecticut. You want to?
Is there any sure way to prevent breast cancer?
There is no sure way to prevent breast cancer, but by making healthy lifestyle choices, you can decrease your risk significantly. I can take one more question.
How many with breast cancer survive?
In the U.S. today, there are more than 2 million breast cancer survivors, and that is because of early detection and prevention. Let's see now. I would like to conclude today with this. There is hope in the fight against breast cancer. I hope today I have informed you, educated you, and raised your awareness by discussing the risk, the prevention, and treatment of breast cancer. It is also my hope that each of you join me in the fight by taking care of yourselves. Walk in the local Susan G. Komen for the Cure and donate to the American Cancer Society. Also remember, ladies, breast cancer is not just, awareness is not just in October, because breast cancer can strike at any minute of any day of any month. And one last thing. The woman named Cynthia I spoke to you about in the beginning, I called her Cindy. She was my oldest sister. And this speech is dedicated to her. Thank you for coming.